tell your eye doctor that you have a toothache? Probably not, but you should tell your dentist if you have a heart condition. The American Association of Periodontology states that oral health and heart disease are connected by the bloodstream. The blood carries bacteria from the mouth to the heart, where the bacteria can latch onto any damaged area and cause inflammation. Contracting gum disease increases the risk of harmful bacteria forming in the mouth. This can result in conditions such as endocarditis, where the inner lining of the heart becomes infected. Gum conditions such as gingivitis can greatly increase the risk of bacteria infecting the bloodstream. Signs of gum disease are swollen or sore gums, bleeding gums, signs of infection around the teeth, or persistent bad breath. The specialist at Heritage Dental explain why you should inform your dentist if you have any history of heart disease.
If you're coming in and you have a history of heart disease or any kind of heart treatment, it's wise to mention that to your dentist and hygienist, and it should be part of your medical record. So we can make a determination if we need to clear the treatment through the cardiologist or not, and what precautions to take and what we should do and shouldn't do. So sometimes if it's a very serious case, patient's fragile, they'll go off to the oral surgeon and have the treatment. You have to know when to do that. You can't know that if you don't have the data, if you don't have the information.
However, when a patient comes in for an appointment, we do a complete oral exam. We do the periodontal screening, so some patients might be different. They may need a more frequent cleaning, whether it's their buildup of the plaque and the bacteria, whether it's their overall systemic health. If they have other conditions like diabetes and heart conditions, they might need a more frequent cleaning, like every 3 or 4 months. So every patient is different, and that's usually established at their first visit with us, but at least every 6 months. It's very important because there's a huge correlation between what's going on in your mouth and what's going on systemically throughout the rest of the body. I mean, there's good bacteria in the mouth and then there's bad bacteria. So if that bacteria is creating an infection in your mouth, it is going to go within the bloodstream to the rest of the body. I mean, over 600,000 patients have some type of heart disease. So if we can prevent any type of infection, that's kind of our goal. So it's very important to inform the dentist and the clinician of any health concerns.
The fact that they're already in the office tells me that they are already somewhat cognizant of that situation. But I find that our patients are much smarter about their oral health care now. They're more educated than our parents were. So they understand the correlation between dental health, gingival health, and diabetes, medications, their overall health. People understand that. Now, granted, there's times I have to reinforce that and explain that, and the hygienist and my staff do that on a routine basis. But that connection between oral health and general health is pretty well established. One needs to have a dental examination first to make that determination. You might have excellent oral health care, and perhaps once a year is adequate. On the other hand, you may have a dental condition you're not even aware of, and until the dentist and the hygienist do a thorough examination, you really can't make that determination. Now, we're typically twice a year, and on average, for most people, that's fine. It could be more, it could be less.
In addition, February is National Children's Dental Health Month. Most American children don't see their family dentist until they're well over 2 years old, far later than is recommended by both dental and medical professionals. Most parents postpone that first visit by saying their child's too young, doesn't have enough teeth yet, or that they don't have the needed insurance. According to the American Academy of Pediatric Dentistry, it's very important to keep baby teeth in place until they're lost naturally. The primary teeth are important for many reasons. Those baby teeth are involved in speech development, save space for permanent teeth, and promote a healthy smile that boosts a child's self-esteem. While likely to refer pediatric patients to other local specialists, Heritage Dental has some recommendations on how to ease your child into the dentist chair.
You should start to bring kids to the dentist probably starting at about 2. They're already consuming normal people food, and there may not be a lot, if any, dexterity in terms of how to brush and so forth. There may be some abnormal growth patterns going on. There's a number of different things that need to be checked. Tooth formation with x-rays, because you can't see in the jaw without doing that. So it's a good age to start to bring the kids in. And the way you want to do it is non-traumatically. What we don't want to have is a youngster of a couple of years old that's got mouthful of cavities and toothache, coming in and now having to have shots and all that nasty stuff that kids don't like. So a lot of times the parent will bring them in when they have their own appointment. You know, sit on the lap, go for a ride in a chair, see the dental stuff in a non-traumatic frame of mind, so that when they do come in for their own appointment, it's not scary. You don't want to bring them in first appointment and scare them. Makes sense.
Start them early. You know, bring them in with your appointment. You know, let them see that it's not painful, that it's not a scary thing to go to the dentist. You know, encourage them at home to brush, to floss, get them in those habits really early. You know, and I'm a parent, so I understand it's really hard sometimes to make sure that your child is brushing. So create the routine with them. When you brush, you bring them in the bathroom with you and have them brush with you. So it's just creating that routine early, I think, helps a lot with children.
You'll find information for the services provided at Heritage Dental when you click the Heart of Dental Health StoryLink icon on our homepage, yourhometownhealth.com.